Are we live? यहीं पे रुक जाता है वो 100% नहीं होता कभी भी.
नहीं वो 99 रहता है.
अच्छा,
don't
we are
worry.
live. We're live. Go. Hi everyone. So sorry for the confusion. For most of the people who are still waiting, thank you so much for your patience. You always try new things and get into some glitches, but finally we are there live. And today's session is thyroid disorders in Indians, a 2026 update. I'm an endocrinologist by background and have been a practicing endocrinologist for the last 30 years. So today I will spend 30 to 40 minutes on thyroid disorders and then we'll take all the questions. So without further ado, we'll get started. So thyroid gland is a small gland, sits in top of the neck in front of the windpipe, and as you can see, it is a butterfly type structure, right lobe, left lobe, and the middle portion. And even though it is a very small gland, it controls your whole body metabolism. And how does it do that? The thyroid gland is very commonly controlled by another gland which sits in the brain called as the pituitary gland. The pituitary gland makes the TSH. The TSH goes down into your thyroid and makes the T4 and the T3 hormone, which is so critical for our metabolism. And as a negative feedback, if your T3 and T4 is decreased, your TSH starts to go up. So this is a very, very simple cycle, and you need both the TSH and the T3 and the T4 to maintain a good thyroid balance. What is the other most important thing? Iodine. And I think that's the most common question which I get. Iodine is a key component to make thyroid hormone. So if you do not have enough iodine, you will not have enough thyroid hormone and you will have a problem. Now, the normal TSH range is 0.3 to 4.5. And depending upon where you go, the range may be slightly different, but we'll talk about this range quite a bit as we move forward. So, what hormones you need to check when you're talking about a thyroid disease? The TSH, like I told you, is the most important. And then you can check free T3 and free T4. We don't check total T4 and total T3 levels anymore because they can increase with pregnancy and they can also change with the protein issues. The reverse T3, a lot of functional medicine doctors will check your reverse T3. It is not an active hormone, so there's really no need to check it unless somebody is sick in ICU. And then the other hormone which we check commonly is antibodies, the TPO antibodies and the thyroglobulin antibodies. And your doctor may check it many times. And finally, there are some specific antibodies which we check for Graves' disease, which is called the TSI, and a thyroglobulin protein, which is really checked for thyroid cancer. So, why thyroid disease matters in Indians? India has one of the highest thyroid disorder burden, but Indians living abroad have the similar risk. So, it's not like just people in India are getting thyroid disease. People living here have an equal chance. Almost 42 million Indians are affected just in India. And another common thing, the women are affected 5 to 8 times more than men. Now, iodine, like we were speaking before, iodine deficiency used to be one of the main reasons in India to cause thyroid disease because we didn't have enough iodine in our water. But now, Hashimoto's or autoimmune disease is the most common cause. And Hashimoto's means you have antibodies against your thyroid, which are starting to kill your gland slowly and slowly. So let's talk a little bit about diet and thyroid. A lot of you have asked questions about that. So adequate iodine important, like I told you, it has a very important role in making thyroid hormone. And iodized salt contains iodine in a good amount, and in US and many other part of the world, the iodine is fortified in milk, in bread, and many other things. So we get enough iodine. However, if you do rock salt, sendha namak, Himalayan salt, or pink salt, they are not fortified with iodine. So if you are constantly eating those salt and you don't get iodine from other sources, you can get goiter because of the lack of iodine. And we'll talk a little bit about that more. Selenium is very important and zinc is very important because what they do is they decrease the antibody formation in the thyroid gland. So it may improve goiter. And then finally, excess of raw goitrogens, like a food which is rich in iodine, which is primarily seafood and dairy. It is not advised in patients, especially if you have an overactive thyroid, because they will fuel further and make your thyroid worse. So, another common question: as a normal human being, what lifestyle factors affect your thyroid on a daily basis? Sleep. So, the thyroid peaks, the TSH from pituitary gland peaks early morning between 3 to 5 a.m. So, if you are not getting good sleep, that peak is going to be affected and you will have a thyroid issue. Stress, all of you know, and we talk about it in the documentary all the time. The stress increases cortisol, which can cause artificial lowering of TSH. And when you have a lower TSH, you feel like you have an overactive thyroid. The stress can also worsen your antibody levels and can precipitate thyroid disease. On the other hand, what does exercise do? Exercise reduces cortisol. It reduces inflammation. It improves your T4 to T3 component, and T3 is the most active hormone in the body. And then finally, nowadays we live in the world of toxins, pesticides. So there are a lot of toxins and pesticides, and we can talk about that in a separate topic. They can trigger autoimmunity, so you can get more antibody formation, and the toxin can also decrease T3 levels. And because T3 being the active component, if your T3 levels go down, you can develop hypothyroidism or underactive thyroid. So let's focus on the 2 or 3 most common disorder which people get through: hypothyroidism or underactive thyroid, hyperthyroidism or the overactive thyroid, and the nodules and the goiter. I probably will not spend time on thyroid cancer today, but I'll be happy to talk to individuals who have issues separately. So let's talk about the hypothyroidism, the most common disorder which we face. It's called underactive because thyroid gland stops functioning. The most common cause of underactive thyroid is Hashimoto's disease and iodine deficiency in this world today. Other reason can be a surgery on your thyroid gland, a radiation to your neck area, and other things, but those are less common. And as I told you, it is the most common thyroid problem. The prevalence is close to 10%. So 1 out of 10 of you can have thyroid problem, and in women it can go up to 15 to 18%. So what happens when you feel thyroid is not working properly or you're hypothyroid? Everything slows down. So when things slow down, you have a decreased heart rate, you gain weight, constipated, sleepiness, fatigue, depression, muscle aches, heavy menstrual cycles, cold intolerance, hair loss, dry skin, you name it. It is almost like I described you're going on a highway at a 30 miles an hour speed. So you feel like a blah, you feel like your whole body is just slowed down. And what weight gain can do, weight gain can increase insulin resistance and can actually worsen your pre-diabetes and diabetes. Most important thing, even a slight increase of TSH. Remember, I told you the range of TSH is 0.45 to 4.5. So even a slight increase of TSH, even though the data suggests 5 to 15, but even a level of 3, 4, 5, a very, very mild increase in TSH can actually change your cholesterol value and increase your LDL. And that is why thyroid and heart are very closely related. The more the LDL, the more the chances of getting heart disease. So this is exactly what the girl on the left side look like when you have hypothyroidism. You get hair loss, puffy face, slow heartbeat, weight gain, constipation, cold intolerance, and in women, you can also get infertility. So that's very important. So what do? You have all these symptoms, you go to your doctor and you ask them to check your levels. The good part is that you can only need one test and that will make the diagnosis. So your TSH will increase as the first sign of hypothyroidism. Like I was telling you on the picture before, the pituitary gland controls. So as soon as the T3 and T4 starts to decrease, the body will send a signal to the pituitary gland to make more TSH. So your T4 and T3 can be completely normal, but the TSH will start to rise. And later on, of course, you get low T3, low T4, but really no other test is required. If you have a TSH and the TSH is rising, you are getting hypothyroid. Sometimes, and we do check antibodies just to find the cause, to see if you have Hashimoto's or you don't have Hashimoto's. And those are simple two antibodies, like I talked about. The treatment is very, very, very simple. Replace with Synthroid or any thyroid medication, and you have the answer. So, we'll talk about and get into this a little bit more about the treatment aspect. So a lot of people keep questioning me and ask me, okay, can I use natural product to improve my thyroid? So there are many herbs which have been studied, like selenium and zinc. I told you that both of them decrease the antibodies. So if you have very early thyroid disease, like your TSH is 3, 4, 5, you have some symptoms and you want to bring it down to less than 2.5, you can take these medications. They will cut down the antibodies and help you keeping the TSH in the normal range. A Brazil nuts, 1 to 2 Brazil nuts a day, actually gives you enough selenium. Shiitake mushrooms, eggs, and seafood have a great source of selenium and zinc as well. So what about herbs or medications or supplements? So there's not a very good evidence on a lot of supplements. Ashwagandha does have small studies between 100 to 200 patients where it was given 600 milligram twice a day, and it lowered the TSH from 5 to 2.5 in those people. However, the duration of the study was only 3 months. So we don't know if people will continue to maintain that or not, but there is at least a small study available to us. So again, if you want to try it for 3 to 6 months, be my guest and you can do it, but make sure ashwagandha does not relate to any other medications you are taking and may not cause any side effects. There's really no good evidence on Google, ginseng, and there are many other products which are being utilized for thyroid. They have no good data at all. So Synthroid is really the mainstay of treatment for hypothyroidism. And how does it work? It is your thyroid supplement. There are very, very important things you need to do with Synthroid. Number one, you have to take it first thing in the morning with water. You don't have to take plenty of water, even a little bit of water will do. But most important, no food or coffee or tea with milk for at least 30 minutes, basically up to an hour. So if you had tea with milk, your thyroid is gone. It is not going to be absorbed. And that is true if you take Synthroid in the evening or late evening. It has to be separated by food for an hour or 2 hours. No omeprazole or stomach medications for 30 minutes to 1 hour. And then no iron, no calcium, and no multivitamin for 4 hours. These are very, very important principles when you take thyroid, and this is going to avoid fluctuations in your TSH. So many patients come to me and tell me my TSH goes from 2 to 12 and then 15 and 5 and 10, and all of that happens because of these single issues, that they don't take their medications appropriately. We always start with a generic medication, but you may need brand if you have fluctuations in levels, because sometimes the generic don't work as good, but you can start with generic. In India, you have to start with a good brand because some of the other generic medications are not tested properly and not regulated properly. So it is very important. One of the other thing before I move to hyperthyroidism is to find out if what your TSH is. So some people feel great with a TSH of 1, other people may not feel as good till their TSH rises to 2 or 3. So each person is born with a TSH which remains stable. So you have to talk to your own doctor whether what degree of TSH suppression is good for you. The second important piece here is some people, especially if they had surgery, may not feel good on just Synthroid because their T3 never goes up, even with the T4. Remember, Synthroid is only T4. So if your T3 is low and you're not feeling the best with Synthroid alone, your doctor may talk about giving you a little bit of T3 or the natural thyroid hormone, which is Armour. Again, we can take that more in the Q&A session. This was a very nice article just published a week ago in one of the lead newspaper talking about facing thyroid disorder, how your medicine has to be taken regularly, and how do we have to take it without food and all that stuff. So again, even government is now paying attention to these things. So let's talk about hyperthyroidism or overactive thyroid. Now here, the opposite is happening. Your thyroid is overworking, so everything is rushed. This prevalence is much less common, only 1 to 4% as opposed to 15 to 20%. So again, here you are actually going on a highway, but you're driving at 120 miles an hour. So what are you going to feel? Your heart will be rushed, you'll have diarrhea, you can have irregular heartbeat, atrial fibrillation, you will lose weight, you have muscle weakness, anxiety, a very, very common phenomena and sometimes is taken for other reasons. Lack of sleep, shakiness, all of that can happen. And again, this is how it's related directly to the heart, that you can have irregular heartbeat, which is not good for your heart. Even a borderline low TSH can increase the risk of heart issues in patients who are 40 years of age or older. Like even a TSH of 0.2, 0.3, 0.1 can cause heart disease. So very important. And more important, that hyperthyroidism, if you have, you need to call your doctor right away. So this is the other side of the woman. You can see it looks like when you have hyperthyroidism. You can also have bulging eyes, which is a very clear part of Graves' disease, but you may not have that. And then you can have all the other symptoms like we just discussed before. So what is the most common cause of hyperthyroidism? Is Graves' disease. This is autoimmune disease where you have a different kind of antibodies, and these are called the stimulating antibodies. So they tell the thyroid to make too much hormone, and that causes Graves' disease. This can be aggravated with pregnancy, menopause, and stress. So any kind of stress can precipitate autoimmune diseases. Then you can have hot nodules, which we'll get to in a second. You can have nodules on your thyroid gland and they start to function too much. You can also have multinodular goiter, like you have multiple nodules, and that can cause overactive thyroid. So how do you diagnose it? Again, simple blood test. You have a decreased TSH as opposed to high TSH, so they go in reverse. If your thyroid is high, your TSH is low. If your thyroid is low, your TSH is high. But you also do a T4 level here because that tells you the degree of hyperthyroidism. If your T4 is starting to go up much higher, you have a higher degree or more severe hyperthyroidism. And then your doctor may take a picture of your thyroid by something called a scan, and sometimes they may do an ultrasound. But again, the key thing is to see a doctor right away if you have overactive thyroid disease. And the treatment, again, not in the full scope of this lecture, but Graves' disease is usually treated with medication, and the two most common medications used are trapazole and PTU, and radiation can also be given. If you have a goiter or hot nodules, then you treat them with radiation and then surgery. But again, as I told you, this deserves a doctor's visit. An appropriate treatment can be planned based on what you have. And if you do not take treatment and you take it lightly, you can suffer serious problems. The third most common thing we see with the thyroid is goiter. Goiter is nothing but an enlarged thyroid gland, like you can see on the left, and you can see the picture shows that your size of the thyroid has increased. So why do you make goiter? The goiter is nothing but a swelling. Again, very, very common in India. And when I was training as a resident, I used to see these 60, 70, 80 years old with goiters like this. Luckily, we don't see that as much now, especially in the urban population, because we are all very cautious about taking iodine, enough iodine in our foods. And the most common cause of this goiter is still iodine deficiency. But goiter can also happen in US, where we have everything fortified with iodine. So there are other things which can cause goiter, like Hashimoto's disease. And then goiter itself can cause different type of problem: underactive thyroid, overactive thyroid. And if the goiter continues to get bigger, then you can get symptoms of compression, like difficulty swallowing, trouble breathing, and a change of voice. So every goiter has to be investigated with an ultrasound, because the goiter can be simple or plain, or it can has nodules. And it is very important to talk about nodules. So if you have a goiter, if somebody points toward you that you have a swollen thyroid gland, please be proactive and get an ultrasound done. So when you do the ultrasound, what do you find? Many times you find thyroid nodules, which are nothing but small structures inside the thyroid. And this is very, very common. If you do ultrasound on people who are walking across streets, 30 to 40% of people will have tiny nodules. But if you start to get nodule above 1 centimeter, Those are uncommon and they're present in 1 out of 4, which is much less common than the 30 to 40%. And if the nodules is more than 1.5 centimeter, the risk of cancer starts to go up. So you have to biopsy them. Even though the risk of cancer is less than 10%, we still need to biopsy the nodule if the size becomes more than 1.5 centimeter. But it also depends what kind of nodule you have. So you really have to have a doctor visit for that. So why do people develop nodule? The reason we develop nodule is again secondary to iodine deficiency. So your body doesn't have enough iodine. So thyroid gland starts to get bigger to trap more iodine. The second most common reason is Hashimoto's, where you have antibodies against your thyroid, and that is genetic. You can't change that. You're born with those antibodies. And once you have Hashimoto's, so you can imagine the thyroid gland is starting to get destroyed. So as a compensatory phenomena, the gland will start to get bigger. It is like you have a factory with a diseased worker, right? So you keep up the production. In order to keep up the production, you will increase the factory size. And when you increase the factory size, the diseased worker may stay in one place and the good worker may stay in the other place. So the factory becomes irregular. Now think about this as a thyroid. So the thyroid factory becomes irregular and you make nodules. So that is the principle behind the thyroid nodule formation. But of course, cancer can also be there. So your doctor will start you with a blood test of TSH and the ultrasound. It is important to point out that even though you have Hashimoto's and sometimes you have thyroid nodule, not every Hashimoto's patient is going to develop hypothyroidism or underactive thyroid. It's only 3% of people every year that develop hypothyroidism. So you may be a person who has Hashimoto's and who has nodules but stay normal throughout your life. And a word about thyroid cancer. It is uncommon in Indian population, but we are starting to see more rise now because we are doing more ultrasounds and we are finding more. But the good part is it is one of the best cancer to get if you have to have one cancer because it does not increase the risk of dying. So yes, if you have to get one cancer, I would rather get thyroid cancer. But again, appropriate follow-up, seeing a doctor is very, very, very important. I think I can't stop without talking about thyroid disease in women. The most common women thyroid disease happen in pregnancy, postpartum, and menopause. The three most stressful parts of women's life, which every woman unfortunately has to go through. So thyroid can affect fertility and menstrual cycle as well. So let's focus a little bit on pregnancy. So what happens in pregnancy and thyroid? Many things can change. Number one, and this is most important, if you are underactive and you become pregnant, the dose of thyroid medicine will need to be adjusted. Why? Because your body needs more thyroid for the growing baby. And even borderline values can be harmful to the baby. And if you're listening, this is most important for younger women. Number one, in pregnancy, the TSH has to be kept below 2 all the time. So a TSH of 3 and 4 is not good if you're pregnant. Number two is this is the only place where we check thyroid function every 4 weeks as opposed to 6 to 8 weeks where there's enough time given. So pregnancy, thyroid, talk to the doctor. The second thing, even if you have slightly increased TSH and you have positive antibodies in a high range, it can cause spontaneous abortion in the first trimester. So again, very, very important to get that thyroid check as soon as you find out you are pregnant, and especially if you have positive antibodies, the selenium can be given and it is safe. Pregnancy can itself cause overactive thyroid state sometimes in the first trimester, and that can persist until second trimester. So you can have some symptoms of overactive thyroid, especially excessive nausea and vomiting. And if that starts to happen, your doctor should check your thyroid. Now, not everyone will need to be treated for that, but if your numbers are very high, you may need treatment. And finally, bottom line, you have any symptoms related to thyroid, like I mentioned before, you have to consult your doctor. And there's no ifs and buts about it. What happens in postpartum? Unfortunately, postpartum can also cause both under and overactive thyroid, which is much more common in Indian women. Up to 20% of women can get postpartum thyroid disease, which is one of the known cause of not able to lose weight after pregnancy. So it is very critical. And the other thing that symptoms are missed because it's just thought to be a part of being a new mother. So we don't pay attention toward our symptoms because we are tired, we don't have the normal menstrual cycle, and we are cold, and you're feeding the baby. So you just passed it off as normal. Thyroid is one of the very common and known cause of postpartum depression. So it is very critical. If you're not feeling good 6 weeks after postpartum, please get your thyroid function checked. And then finally, myths versus facts. So myths are thyroid always causes obesity. The fact is, if you take proper treatment, especially with synthroid or thyroid medicine, it will improve your weight. It will get you back to normal. Yes, you will probably have to do diet and exercise as well, but it will help you with weight gain and weight loss. The other big myth, diet and yoga alone will cure my thyroid. Unfortunately, it does not. Like I told you, the thyroid disease is happening because there is a reason for the thyroid disease to happen. There's a problem, there's antibodies, there's iodine deficiency. So you will need replacement most of the time. Yes, in early stages, if you have a very, very borderline TSH, you want to give natural things a trial for 3 months, 6 months, 1 year, 2 years. It's up to you if you're not feeling bad, but eventually you will need thyroid medicine, especially if your thyroid is failing. It only happens in women, so as a man, I can't get it. Completely wrong. It happens in both. And finally, once your thyroid is normal, this is the most common question I get. Can I stop the thyroid now? No, you will need medicine for lifetime. Once again, it's a disease which happens due to some genetic problem or other issues. You cannot stop thyroid once you have started. So if I had to summarize, I try to keep it short and sweet so we can actually have more time for question and answers. The thyroid disorders are very, very common in Indian population. Number one. Number two, early signs can be missed. Even early stage of thyroid can increase LDL and can cause heart dysfunction by irregular heartbeat. And of course, osteoporosis, which I didn't touch upon. But if you have overactive thyroid, it can also cause osteoporosis or make it worse. So do not take your thyroid disease lightly. Please, please seek appropriate care, see a doctor, and take appropriate care. So I'm going to stop here and then take questions. And I know that we have some questions coming in already. You can also ask any questions in the chat section or in the Brown Hat WhatsApp group, which is now open. And we'll start with the questions which have already come in. So one of the questions comes in, do medication affect thyroid? So it all depends upon which medications are you taking. Like I told you, any medication that contains calcium, iron, multivitamin, they strongly affect the thyroid absorption. If you have liver disease, that can absorb thyroid absorption. And if you're taking medication for seizures, that can clearly affect thyroid absorption because they increase the clearance of the thyroid. If you take birth control pills, that can falsely increase your T4 and T3 levels. So that can also cause abnormal thyroid blood work. And one of the other things which I didn't point here is if you take biotin. I think a question came in and I forgot to address that during my lecture. But if you take biotin can affect thyroid levels. It can impact your TSH and the T3. So if you by chance are taking biotin, because it's a hair loss vitamin and many people take it, please stop it for 3 to 5 days before you are going to get any TSH done. Otherwise, your levels will not be normal. So if you take biotin, you can take it, but it will affect the thyroid levels. Just keep that in mind. And the question came in, is thyroid an autoimmune disease? And I think I have sort of spoken many, many times about that. Thyroid is clearly an autoimmune disease, but not thyroid cancer. So the nodule formation can happen due to autoimmune disease like Hashimoto's. The Hashimoto's thyroiditis causes hypothyroidism or underactive thyroid like we spoke about, and the most common antibodies which are positive are TPO antibodies or thyroglobulin antibodies. And then of course the overactive thyroid is clearly one of the common cause of overactive thyroid Graves' disease is autoimmune and where you have a specific type of antibodies called as TSI. So I hope that answered your question. Now, one question came in how to bring your PTH down. So, PTH is a very different hormone, not thyroid hormone. And when I was showing you the thyroid gland, I didn't point toward, but there were four small glands on top of the thyroid. And these are called parathyroid hormone. And parathyroid has nothing to do with thyroid. Parathyroid hormone control calcium metabolism, and they're completely separate topics. But to answer your question, the parathyroid goes up if your calcium is low or if your vitamin D is low. So when you have a high parathyroid level, you need to get your calcium checked, you need to get your vitamin D25 level checked. And if those are low, vitamin D is low and your calcium is low, if you supplement calcium and if you supplement vitamin D, your parathyroid hormone will come down. But it's a different topic. You can also have parathyroid tumors. So again, if you have high calcium and parathyroid, it is a completely different answer. If you have a low calcium and high parathyroid, it is a completely different answer, and you need to really talk to your doctor about it. So hopefully that will answer your question on parathyroid. So one other question came in for hyperthyroidism. Do you have to take lifetime medications? A very, very important question. So like I told you, the cause of hyperthyroidism are different. If you have Graves' disease, which is autoimmune overactive thyroid, you will be given medications up to 2 years, 1.5 years, 1 year, depending upon how severe your disease is. There is a good possibility that if you continue those medications for hyperthyroidism and your antibodies level go down, that you may not need medication for lifetime for overactive thyroid, which is wonderful. However, there's a only 60% chance that you may not need antibodies, may not need medications for lifetime. There's a 30% chance that when you stop the medicine, the hyperthyroidism comes right back and you have to take the medications again. The other thing is, if you have a nodule, if you have a big nodule in your thyroid and that is causing overactive thyroid, like this is the concept like I was telling you in the factory, you have diseased worker and you have workers which are overproducing because they're working harder. Same thing happens in the thyroid. So you have some cells which are working too much and they make a hot nodule, which means it's working too much. That hot nodule is not going to go away for lifetime. So you may have to take medications for lifetime, or you may have to treat that nodule with radiation or surgery to get rid of that. So hopefully it's a long-winded answer to a small question, but hopefully that will help you. Then the other question came, what does the high level of thyroid peroxidase antibody mean? I think we were just touching upon that. It is called the peroxidase or the TPO antibodies. And these TPO antibodies can actually cause the destruction of the thyroid gland because these antibodies are the hallmark for what we call Hashimoto's disease. So if you have high TPO antibodies, you have a 3% chance, roughly 3% chance of becoming hypothyroid every year, which means that people with TPO antibodies or the peroxidase antibodies will become hypothyroid at some point in their life. We just don't know when. So the good part is there's a lot of data coming out that this is causing inflammation in the thyroid gland. And there are 2 or 3 things that can help this inflammation. Mainly the best data is on selenium. So if you take selenium in form of Brazil nuts or selenium, 100 to 200 milligram per day, no more than that. More than 400 milligram of selenium can be toxic. So take 100 to 200 milligram of selenium and you may lower the antibodies. And zinc also helps lower the antibodies. So zinc supplementation have sometimes in short studies have been given to lower the antibody. So how do you help? If your antibodies are lower, there is a chance that you may not develop underactive thyroid as quickly as you would have. So hopefully that will answer your question of TPO antibodies. And if you have any other questions, one of the story I always tell my patients and many people is one of the lady came to me. She was 33 years old and had very high level of antibodies, which were not checked ever. And she had 4 miscarriages, spontaneous miscarriages, during the first trimester. And then finally, somebody ended up checking thyroid antibodies because the patient starting to look up herself and found out that the high level of antibodies can cause spontaneous abortion. So she had a level close to 6,000 to 8,000 when she first came to us, and we talked about not getting pregnant till we get the antibody levels lower. And we gave her selenium, and luckily, in 6 to 9 months, her antibodies level decreased to 300. And not only that, she had two successful pregnancies after that. Of course, she developed Hashimoto's and she developed hypothyroidism, and now I treat her for underactive thyroid, but at least she was able to have two successful pregnancies. So that's a good story to hear. Okay. Do eggs keep to decrease the thyroid level? So, like I tell you, egg is a very good source of iodine. So if you're taking eggs, you have good source of iodine. It is not going to cause any problem with your thyroid if you are overactive. If you have very overactive thyroid, then eggs may add as a fuel like an iodine, and iodine can worsen hyperthyroidism, but they do not decrease your thyroid. Any form of iodine supplementation, especially if you don't use salt, because salt is the biggest source of iodine, and if you live in some part of the world where your milk is not fortified with iodine, you believe in natural milk sources, or your bread is not fortified with iodine, then you may need to take these iodine supplements or good sources like egg, like I told you, salt, bread, milk, and seafood. Are there any other questions? Just look in the chat.
Does GLP medication affect hypothyroidism?
Okay, another nice question came in. Does GLP medications affect hypothyroidism? So GLP medications do two things and it can cause problems. So once the GLP medication can actually cause a very rapid weight loss, right? So if you're going to lose weight, thyroid is a medication which is given on weight based. So if you're taking 100 microgram thyroid and you have suddenly lost 25 to 30 pounds of weight, yes, you will need to adjust the medication because suddenly you will become hyperthyroid because your medicine becomes too much. And that is the best way to follow, is to see the doctor. In fact, when my patients go on GLP-1, I actually check their thyroid levels every 3 months to make sure they're not hyperthyroid. The second important thing with GLP-1, I think a lot of people ask that question. There is clear data that GLP-1s cannot be given if you have a very specific type of thyroid cancer, like medullary thyroid cancer. And that is very rare and uncommon, so we don't worry about that. But because we are doing more thyroid ultrasound before we start people on GLP-1, we are also finding that there's a lot more people with thyroid nodules, and maybe some of them will have thyroid cancer. So the paper was published, hey, the GLP-1 can increase the risk of thyroid cancer. It does not increase the risk of thyroid cancer, but we are detecting more thyroid cancer because we are doing many more ultrasound. So important point, if you have a nodule, if you have a thyroid nodule, and if you have an ultrasound done, since you feel something, that nodule, if above 1.5 centimeter, has to be biopsied before you start GLP-1. So that's a very important thing to know. How much iodine do we need? I think up to 150 microgram per day, but between 40 to 150, most of the time, we actually get iodine if we are eating a balanced food. So you don't need iodine supplements. The prenatal women need more, so that's why they give prenatal vitamins, which has good amount of iron and iodine. Do we have any other questions?
We can just give maybe 30 seconds more and then we... Oh wait, I missed the beginning. What is to be done for increasing TSH but still within normal range? I think it's a great question.
So one of the question, a great question. I think I was trying to pay some importance to it before. The question came in, what if the TSH is still within the normal range? Do I still need to take thyroid medication? So like I explained you, the TSH range is between 0.45 to 4.5. TSH remains normal throughout our life, except then when we become elderly, like above 75 years of age, the TSH starts to go up. So a TSH of 4 or 3.5 or 4.5 may be completely normal if you are an 80 years old. But a TSH of 3 and 4.5 is not completely normal at all if you are in the younger group, and especially in the reproductive age group between the age of 18 to age of 45. Because if you get pregnant, for the health of your baby, your TSH has to be less than 2 all the time. So for all others, 2 to 3.5 can be a range where you may feel normal or you don't feel normal. By and large, all of the endocrinologists will like to keep the TSH at less than 2.5 because that is the most physiological data we have. Now, between 3 to 4.5 is where the data gets muddy. So there are few things that can start to happen. Number one, your LDL can start to go up even with that little increase in TSH. Number two, like I told you, if you have Hashimoto's disease, that is the first sign of the failure of thyroid gland, especially if you have positive antibodies, and your thyroid will start to get bigger, even with that TSH. So you will start developing a goiter. And number three, you can actually start to get symptoms at that TSH, like a fatigue, difficulty losing weight, some cold intolerance, too much sleep, and just not feeling the best. So if you have a TSH of 2 to 4.5 or 2.5 to 4.5, it really depends upon what other things you have. So I will treat patients only if they have positive antibodies. So I know that they have a disease. I will treat them if they have a goiter, or I will treat if they have symptoms. If you don't have any one of these, you can easily follow and continue to wait till you start to get symptoms and then treat. But there is very clear data that if the TSH goes above 10, you have to be treated for thyroid disease or you're going to start getting into major issues.
Let's see, one more is coming up. Just a second.
Yeah, I'll still give people time to write questions, but thank you for listening despite the technical difficulties we had.
Give a second. There is someone typing away here. Otherwise, we'll call it a day, but we'll give them just one more second.
Yeah, I'll give a few more seconds for anybody if they want to write any questions.
Okay, so if thyroid can cause high LDL, should you go on a statin with normal LP little a and calcium scan?
Very, very important question came in. If the thyroid, the TSH is a little high and it can cause a little high LDL, and your LP little a is normal and your CAC score is normal, should you go on a statin? So if your TSH is 3 or 4 or 5, I would rather treat the thyroid than giving you a statin, because between the two, the thyroid is a much simpler medicine to take and has much less side effects, right? And if I give you a low dose levothyroxine, like 25 microgram, which is a very small dose, and I can keep your TSH around 2 or 1.5, you might see a drop in your LDL. And if your LDL comes down, there's nothing like it. If your LDL still remains high, despite bringing the TSH to 1.5, and you have to give it 3 to 6 to 8 months, it's not like it's going to change tomorrow. And then if your LDL still remains high, then I would suggest that you go on a statin, depending upon your family history and other risk factors.
We'll give another 10 seconds or so, and then
I think we still have people writing some questions, so we'll keep waiting for a few others.
okay. So if that okay. Okay, so I think we are okay. So I think we're good. You can
Okay.
close off.
Thank you all of you for joining. And once again, we truly apologize for the glitches we had in the technicality of the seminar or the podcast. Hopefully, we'll see you in the future soon. Thank you.